Hello, it's Lindy here from Park Meadows Pilates and Physical Therapy with another Pilates tip for you. Today we're going to talk about an exercise where we move from the hip joint while stabilizing the pelvis and the lower back. This is typically called a hip hinge exercise. You also might know it as a dead bug exercise. The importance of this exercise is that you learn to use the stabilizing muscles of the pelvis and the lower back, also the abdominals, in order to move from your hip joint. Tip number one of this series, which is this one, is going to be starting you lying on your back with your feet up against a wall. So you'll be in what we call a 90-90 angle, 90 degrees at the hips and 90 degrees at the knees. So what that's going to look like for you and your body is that you're going to be lining your femur bone up inside the hip joint. So here we have a pelvis lying on its back, the spine is up here, rib cage is above, and right here is the hip joint. So the thigh bone, the ball part of the ball and socket, will be sitting into the joint exactly like this. So here's the ball of the femur, here's the socket, which is the other end of the hip joint, stacking up just like this vertically. Your knee would be bent at 90 degrees with your feet against the wall. So if you imagine the lower leg parallel to the floor as we have it here. So if you imagine this little block like your pelvis and this cylinder like the femur bone, we want to make sure that the pelvis is aligned correctly so that the cylinder can balance on top of it. If either one of those things are not aligned correctly, then we're not going to have good balance between the two. So the trick here is figuring out how to align the pelvis and how to align the thigh bone so that they balance easily with a minimal amount of effort. So all that sounds great in theory, but where is this happening in your body? Obviously at the hip joint. So take your fingertips right now and just place them at your hip joint, where the thigh attaches to the pelvis. Where is the ball and socket joint in your body? Is it up here? Is it out there? Is it over there? You might be surprised to know that it's actually quite deep and close. It's narrow to the center of your body. The easiest way to find this joint is if you take your thumbs, put them on the outside bump of your thigh bone, and walk your index finger across towards center. You'll find a little divot right there, a little drop in the soft tissue, if you will. That is right where your hip joint is. So this is the place that this movement is going to be happening from when we do the hip hinge exercise from the wall. So here we are in the starting position for the hip hinge at 90-90, or the hip hinge with the feet on the wall. You'll notice in this position that my thighs are relatively vertical. And I'm thinking about allowing my femur bones to drop down into the pelvis. Now if I flatten my back from this position, the alignment of my pelvis and the alignment of my leg changes so much that I'm really not allowing my legs to drop down into the joint. So it's really important here to feel the center of the back of the pelvis without flattening the lower back. Remembering where the hip joint is and remembering that the movement needs to happen but at this ball and socket joint, you're simply going to float one leg off the wall. It's only going to come off about an inch or so, and allow yourself the feeling as if this leg all of a sudden weighed 2 or 3 times as much, meaning that the weight of the leg is dropping straight down into the pelvis. You're going to lower the leg back down onto the wall and repeat this on the other side. The goal of this exercise is to feel the movement exclusively in the hip joint while maintaining the pelvis in its balanced position. So if, for example, I were not stabilizing the pelvis, this is what might be happening as I move the leg off the wall. I also might notice that my pelvis tips a little bit from side to side, one way or the other, to take the leg off the wall. This obviously is not moving from a stable pelvis, and I wouldn't be moving exclusively from the hip joint. So keeping the pelvis as still as possible as you move the legs from the hip joint. A note about this: if you have neck pain or neck stiffness, or if you have a forward head position, you may want to do this exercise with a small towel. You'll know that your neck is in an incorrect position if you're looking back at the wall behind you. In that case, you want to take a small towel under your head just to position the head so that it's a little more balanced over the spine. You'll notice that there's relaxation in the neck when you support the head with the towel. Much more important to have relaxation in the neck and the spine supported in an ideal position than to do this exercise with excess tension. Thanks for watching. I'll see you next time.